Thank you very much for joining us today, Adeshida Atinuke. She is a registered dietitian, nutritionist, baker, a millionaire, and as well, she is a creative director of Diamond Bites and Briders. Today, we will be having an oral interview on adequate nutrition for girls and women, and I will be asking her some important questions pertaining to women's nutritional health. Thank you very much once again, Mrs. Adeshida. And the first question will be, can you tell us what inspired your journey into becoming a nutritionist or a dietitian?
Well, thank you for that question. My journey into nutrition was inspired by my desire to improve health and prevent nutrition related disease, which is associated with poor dietary pattern or habits, as the case may be.
Thank you very much for that. And what role did education play in helping you balance your professional life with family responsibilities?
Well, in my school, then they normally tell us that education has to pass through you. You don't have to just pass through the university. You allow the university pass through you. So during my time in the university, we have to do with a lot of things. So time management. So education equipped me with time management. It helped me make informed choices and decisions about nutrition. Thank you.
Thank you so much for that response, dietitian Adeshida. And can you kindly tell us your area of specialization in nutrition?
That pediatric nutrition. That's nutrition about for children, infants, children,
Oh, thank you
pediatric.
very much. Thank you very
Yeah.
much. Because children nutrition is actually very important because we have a lot of cases of different nutritional health diseases when it pertains to children. And it's more or less like we are grooming them from a very young age. It is what we feed them while they are young that they are going to grow into. Thank you very much for choosing that particular line. And our next question will be, what is different between a registered dietitian and a nutritionist?
Well, nutritionist, as a nutritionist, that means you have to go through the 4 or 5 years course in the university. So you will be certified a nutritionist. So a dietitian, on the other hand, is about you going through dietetics internship, being trained by dietitians. So after that, you have to pass the required examinations and be certified a dietitian. So a dietitian can do the medical nutrition therapy, while a nutritionist cannot.
So thank you very much for that. So you are a registered dietitian and also a nutritionist.
Yes, yes.
Okay. Thank you very much for the clarification. The next question is, what are the most common nutrition related problems you see in your practice?
Overweight. A lot of children, you just see them, they are being overweight, and it predisposes them to excess weight related problems such as high blood pressure and the likes. So overweight children, underweight, micronutrient deficiency, there's macro and there's micro. That has to do with vitamins and minerals. That's the micronutrient deficiency. Then iron deficiency too.
Oh, thank you very much for that. I have a very important question because you mentioned hypertension. Are you referring to the fact that we have hypertensive children these days
Yes, there are hypertensive children now. Yes,
due to poor nutrition?
due to poor nutrition.
Oh, that is very amazing. Thank you very much for that information. It is very important for us to actually feed our children, our words, while they're young so that they don't have all these health related issues. Thank you very much for that clarification. Our next question: what does a balanced diet look like for an average adult woman, a teenage girl, and a girl child? Is there a kind of portion for them or a kind of food to restrain from just to have a good nutrition, to have the balance?
Okay, for a girl child, as even from infancy to adulthood, the size of the stomach differs.
Okay.
So the quantity a girl child will eat will be different from what an adult will eat. So so that we can make up for their nutrition requirements. So for a girl child, you have to make their food nutrient dense so as to help them with growth and immunity. For a teenage girl, she'll be doing menstruation by that time, so she needs food that is dense with iron. She needs more of iron, and she needs more of calcium for bones and growth, for healthy bones, then energy. Then for adults, they need more of fruits, vegetables, iron, calcium too. I think this iron calcium of a thing is just between the teenage to adulthood, like is required in their diets. Yeah.
Oh, thank you very much for that. So we know how important it is to actually have the appropriate nutrition per age. The
Yes,
next
yes.
question, it actually brings us to the next question, which is how important is portion control in maintaining good health? This is actually cut across both the adult women, the teenage girls, and also the girl child. How important is portioning their food in maintaining a good health?
Well, portion control is very good because it helps in weight management. Because as I said earlier, obesity predisposes someone to different illness, different disease, different chronic diseases. So if you can um, um, do a portion calorie control, you'll be able to maintain a good weight, that's a normal weight, and so as to reduce the risk of obesity and chronic diseases.
Thank you very much for that information. Uh, our next question is what are the signs of poor nutrition, cutting across all the age ranges that we mentioned earlier?
Okay, for let's say for ages 0 to 5, when they are not being fed properly, so it predisposes them to malnutrition. That's it can show as stunted growth.
Okay.
So there's anemia, there's weight gain or loss, fatigue, poor concentration. They don't reason well because they are irritable. They are irritable. Any little thing irritates them. So fatigue and the likes, frequent illness because their immune system is low.
What about for adult women? What are the signs of poor nutrition that can be observed in adult women?
Yeah, fatigue, frequent illness. They are sick almost all the time. Their immunity is low. So when you are not feeding well, the nutrients and you are not getting absorbed the way they are meant to. So definitely it will call for a signal that something is lacking.
Okay.
So that
Thank you
is it.
very much for that information. And how does nutrition affect immunity and disease prevention? Like you earlier mentioned, that it affects their immunity and all. So,
Mhm.
does nutrition affect how strong we are? And also, does it help to fight against some certain diseases?
Yes, yes. I mentioned something earlier about micronutrient deficiency. A lot of people don't know that they are being deficient of that. So, but when you eat everything in the right proportion and you're having a proper nutrition, so it will help to prevent illness and also treat them.
Oh, thank you very much. Because in several cases, we've actually heard of people that are vitamin deficient, vitamin B12, uh, iron,
A,
and all. So
yeah.
when we have proper nutrition, it helps to prevent all these deficiencies and also diseases.
Yes, yes, because adequate nutrition is about making everything sufficient in the right proportion. So if you do it properly, then you'll be okay. Like no sickness, no illness, at least to some extent.
Thank you very much for that information. And our next question is, can proper nutrition help manage chronic diseases like diabetes, hypertension, and all other chronic illnesses that we actually battle in this particular century that we are in?
Yes, yes. There's for let's say for hypertension now, there's a diet we call DASH diet. That's dietary approach to stop hypertension. It has to do with salt and salt, fat, and other nutrients modification. That's for hypertension. Then for diabetes, it has to do with calorie control so as to regulate the blood sugar.
Regarding diabetes, I actually have a very important question regarding it. I know we have the
Okay.
type 1 and the type 2 diabetes. Uh,
Yeah.
does proper nutrition actually help in managing both types of diabetes?
Well, I can say yes and I can say no. For diabetes mellitus, I can say proper nutrition can help, but type 1 is it can only be controlled by dietary insulin or maybe um, that's they collect insulin from the medical practitioners. You understand what I mean?
Yes.
So that type 1 diabetes is mostly inherited.
Okay.
It's mostly inherited, and there's should I say a little to what diet can do
Okay.
to maintain it. There's a little, but for diabetes mellitus, on the other hand, diet can do a lot. Not just diet, lifestyle too.
Okay.
Lifestyle, what you take in, your exercise, your activity level. So that's it.
Thank you very much for that information. And what role does hydration play in overall health?
Hydration supports digestion. That is why when you eat, you take water at intervals. You don't wait till you are done with the food before you take water. So as to help with digestion, water helps to regulate temperature.
Okay.
Yeah, that's our temperature. So water helps to regulate our temperature. It helps to transport nutrients. It helps in waste removal and overall body function.
Oh, thank you very much. So it's very important for us to always stay hydrated.
Yes, yes, yes.
Okay. Thank you so much for that information. And can you kindly give us the BMI for girls and women? And also, can you even tell us what BMI is all about and the standard one for each age group?
Okay, BMI is body mass index.
Okay.
So it is used to know your body mass. So there's that for underweight. There's an indication. It has indices. So there's an indication for if you are being underweight, you have a normal weight, you are being overweight or obese. And before I can give you the value, I have to tell you how to calculate it so that you can know how to do it right. That's your weight in kilogram. You have to know your weight in kilogram and you have to know your height in meters.
Okay.
So your weight as the numerator and your height as the denominator squared. So for example, if your height is 45 kilogram, so that will be at the top. Then you divide it by your height
Okay.
in meters squared. So for example, if your height is let's say 1.5, so that will be 1.5 times 1.5. So when you divide it, you will be able to, you get a figure. You now place your figure in between these values and see if you are being underweight, you have a normal weight, or you are being overweight or obese. So from for underweight, it is below 18.5 kilogram per meter square.
Okay.
Underweight is 18.5, below 18.5 kilogram per meter squared. For normal weight is 18.5 to 24.9 kilogram per meter squared. For overweight is 25 to 29.9 kilogram per meter squared. Then obese, that's above 30 and above, 30 kilogram per meter squared and above is obesity.
Oh, thank you very much for that. Is that the same calculation for both young girls and adult, or there are clear distinctions between the way they are being calculated?
Yes, yes. There's a formula. We have pediatric formula to calculate that of children,
Okay.
which is different from um adults, from for teenage girls and adults.
Okay.
So not only a formula, then there's a growth chart, which is designed by World Health Organization. There's a growth chart to know their percentile. That is for children. But for adults, I just mentioned is just for a body mass index is for teenage and adults, not
Okay.
for children.
Okay. Okay. Thank you so
There's
much.
head circumference for children. There's head circumference. There's bicep and others for children, but not for which adults can use too. Adults cannot use head circumference, but they can use bicep. That's their trifold.
Okay.
I hope. Do you understand?
Oh, definitely, definitely. Thank you so much for that information because we need to know where we actually stand when it comes to normal body weight and all. So, and getting to know the information on how to calculate our BMI and also the appropriate BMI per age and also how to calculate for the children. It's actually very important, and I have learned a whole lot today, which brings us to our next question, which is what nutritional advice do you have to give pregnant women?
The first thing is attend regular antenatal care. Okay, now the nutrition part, maintain a balanced diet. You have a life being growing in you. Your food has to be um balanced. It has to be adequate. The nutrients must be sufficient. Something sufficient for you and the baby growing in you. And there's a increase in calorie intake now, because now you are eating for two and not eating for yourself alone. So the food has to be nutrients dense, including iron, folic, calcium, protein, varieties of fruits and vegetables, all grains, and most importantly, stay hydrated.
The importance of
Hydration cannot be Yes, hydration cannot be overemphasized. Stay hydrated. Avoid alcohol, junk foods, roadside foods, fast food. Just avoid them. Anything you feel, even your doctor or your dietitian tells you is unsafe for you and your child, just try and avoid them.
Oh, thank you very much for that information. I'm sure a lot of pregnant women are going to see this video and they are going to learn one or two things from the advice. And what dietary consideration are important for the elderly?
For the elderly, now they will have slow digestion, and some may have problem with mastication, or even have dysphagia. That means they can't swallow food. So their food has to be in bits. It has to be soft, something they can easily chew and swallow. um, their bones are now weak, so they need foods that are rich in calcium and vitamin D. Then they need fiber now. They need fiber for easy bowel movement. They don't have to strain their muscles so as to pass through. So they need something that can just move easily and stay hydrated too. Because most of them forget to take water. Most of them forget to take water. So they have to stay hydrated and eat well. They can't eat in large portion now. So just make sure that the food, the little they have, is balanced.
Okay.
Yeah, even if they are meat, they still have to take protein. They still have to take protein if unless their health status says otherwise. They need protein. So their meat, their fish has to be soft. They should stay away from any saturated fat. Yeah, like that.
Okay, thank you very much for that information. Because we need to take care of our elderly as well. And I have this important question because we have a lot of people doing it. Some says it works for them, while actually indifferent about it. So the question is, what are your thoughts on intermittent fasting and ketogenic diet? For those trying to lose weight, is it something that we should consider? What are your thoughts on this particular means of weight loss?
Actually, it may benefit others and bring harm to others. Diet itself is individualized, so you have to see your dietitian so that they can help you to plan it if it will work for you after considering all the factors, maybe your health condition and everything, to make sure to ascertain that it won't bring harm to you. So it may benefit some and bring harm to others.
Okay, thank you very much for that information. For those that want to practice this means, now you know that it is actually individualized and you need to talk to your dietitian before you start any journey regarding your weight loss. And how do processed food rather affect our health in long term?
One of the major causes of obesity right now, it has to do with processed foods because the fiber the fiber that is meant to absorb this fat, it has been processed and everything has been reduced to a very minimal level. So processed food is one of, should I say, one of the things that is causing obesity right now. Diabetes mellitus, high blood pressure, heart diseases due to high sugar, salt, unhealthy fats, and additives. All these food additives you don't know. I'm talking about the chemical parts now. Chemical additives, their composition, it brings harm to the body. Preservatives, the preservatives they put in these processed foods can cause harm to the body.
Okay, thank you very much for that information. So, in other words, we should try as much as possible to avoid processed foods.
Yes,
Okay.
like if you can limit, just limit it. Mhm.
Thank you very much. I'm going to divert a bit into women and girls in today's society. So I'd like to ask you, from your experience, why is education especially important for women and girls today?
Education boosts confidence.
Okay.
It empowers you with knowledge so that you can make informed choices. Nobody will just tell you vagables and you believe. But when you're educated, you'll be able to make your choices, you'll be able to decide. It will help in decision making and it will help you contribute to your society. So, education is very important.
Oh, thank you very much for that. There's a particular saying, I've said that like a couple of times, that when you train a girl child, you're not just training a person, you're training our entire generation, because that way she can actually help to make a lot of informed choices and all, and she can also better our society, because when you train a girl child, you train a whole generation, you train a whole society. Thank you very much for that information. And do you believe educated women are better equipped to advocate for their health and well-being?
Mhm. Because they understand things faster. Because they are being educated, they are, even if you tell them a little thing, they will be able to think far, think wide, like it will enlarge their scope about any information they receive. So yes, when they are informed, they can teach others.
Oh, thank you
They
very
can,
much.
teach others. They can help them make right choices too.
Well, thank you very much for that. So by this, we actually know that they can make a lot of important decisions when they are educated, and it also helps with their well-being. Thank you very
Yes.
much for that information. And how does education, from your perspective, help women look beyond limitations and societal labels? Because our initiatives about we are looking beyond the surface. So how does education help you to look beyond limitations, beyond what people say you cannot do just because you're a woman? Thank you very much.
I said something earlier that education helps to broaden your scope. So, as an educated individual, it helps you to identify and pursue opportunities. You'll be able to identify opportunities and see beyond societal expectations.
Thank you very much. Because the society actually plays a lot of pressure on women, even from a very young age as a girl child. They expect you to feel pain and don't talk. They expect you to go through everything just because you're a woman. When you say that, okay, I'm feeling a bit of pain, they'll be like, oh no, you're not meant to say that out loud. As a woman, you should be able to, uh, I don't know how to put it, to endure pain just because you're a woman. So I'm happy that you actually share that information with us, because we are looking beyond what the societal values or what the society actually plays on us as women. Thank you very much for that, dietitian Adeshida. And the next question is, what message would you like to share with young girls and even women in some cases who feel education is out of reach?
What I would say is, if you can set your mind on it, you can achieve it. So
Thank
that
you.
you can set your mind on it, you can achieve it. Taking it step by step, having your plans laid out step by step, gradually. Don't think you just want to absorb everything at once. Just take it step by step, and you just see yourself achieving everything.
Thank you. Thank you so much. I actually have one lecturer that always emphasized on something. He said that anytime they call out first class graduate, and then he from the backstage he see different ladies coming out to collect the certificate and the award of academic excellence, is always like wow. Like even if the society says that you cannot do it just because you're a woman, and then despite the pressure and all, you can still win the medal at the end of the day. That actually makes you a super woman. Thank you very much. And how can initiative like Beyond the Surface of Life support women through education? How do you think we can actually bridge the gap regarding education?
Through program like this, through program like this, I'm very sure a lot of viewers will see this and will start making choices about their life. So program like this creates awareness for people to know that being a woman is not a barrier. age, being old or young, is not a barrier to education. So you are doing a good job. So programs like this will really help.
Thank you very much for that. Thank you so much. I don't want to say our head is swelling, but thank you so much for that. It means a lot to us. And we have actually come to the end of the interview, but we'd like to ask you, Dietitian Adeshida, if you can kindly tell us your social media handles and how best to contact you professionally.
Okay, my social media handle on Facebook is Elizabeth Atinuke. Um, my professional handle is NutriTruth Health Coach, also on Facebook. Just type NutriTruth Health Coach. I'll be there. Thank you.
Thank you so much for this educative interview. Thank you so much for enlightening us on a lot of things that we ought to know as women, as teenage girls, and also as girl child. Thank you so much today. And we wish you all the best in all your endeavors. Dietitian Adeshida, thank you so much. And thank you very much, everyone. We've come to the end of the live interview. See you next time. Bye.
Bye. Thank you.